Have you ever thought that letting a wound breathe or air out speeds up the healing process? This belief is a common misconception that often leads to improper wound care. While it's true that oxygen plays a key role in healing, exposing a wound to open air can actually slow down the process. It leaves the wound susceptible to contamination and dehydration, both of which can impede healing. Another prevailing myth is that all wounds need antibiotics. While antibiotics are crucial in treating certain infections, they aren't always necessary for every wound. Overuse of antibiotics can lead to antibiotic resistance, a serious global health concern. These misconceptions underscore the importance of understanding wound care. It's not just for medical professionals, but everyone. After all, minor injuries can happen to anyone, anywhere. But armed with the right knowledge, we can ensure they heal properly. Now that we've debunked some myths, let's delve deeper into the science behind wound healing. The moment your skin breaks or gets a puncture, your body's intricate healing process kicks off. That's right, our bodies are equipped with a highly sophisticated system designed to repair any damages that occur. In the face of a wound, the first phase of this process is inflammation. Let's delve a little deeper into this initial stage of wound healing. Picture this. You've accidentally cut your finger while chopping vegetables. Almost instantly, your body springs into action. The objective? To prevent any further harm and kickstart the healing process. To achieve this, your body first needs to form a clot at the wound site to stop the bleeding. This is why you'll notice the blood starts to thicken and eventually harden after a while. But the real stars of the show during the inflammation stage are the white blood cells. White blood cells, or leukocytes, are the body's first line of defense against infection. They are dispatched to the wound site almost immediately after the injury occurs. Their mission? To ward off any bacteria, viruses, or other harmful invaders that might try to take advantage of the breach in skin. As the white blood cells get to work, they cause the area around the wound to become red and swollen. This is a telltale sign of inflammation. While it might seem alarming, it's actually a good thing. It means that your body is doing exactly what it needs to do to protect itself and start the healing process. It's also worth noting that inflammation can cause some discomfort. You might feel some heat, pain, or even lose some function in the wounded area. But don't be too alarmed, these are all normal reactions and they're temporary. They will subside as the inflammation stage draws to a close and the next stage of wound healing begins. So next time you get a cut or scrape and you notice it's red and a little swollen, don't panic. Your body is just doing its job. While inflammation might not look pretty, it's a crucial first step in the healing process. After the initial inflammation phase, your body enters the proliferation stage. Now, this is where things really start to get interesting. During this stage, your body is hard at work, creating new skin cells and blood vessels to repair the wound. It's almost like your body becomes its own construction site, laying down new foundations and building up from there. It begins with the formation of granulation tissue. This pink or red tissue is soft and full of tiny new blood vessels. It's the body's way of saying, "Hey, I'm working on it." It's a sign that your body is doing its best to heal. Next, your body begins to produce collagen, a protein that is essential for wound healing. Think of collagen as the scaffolding of a building. It provides the structure and support that the new skin cells need to grow. Without collagen, the wound would not be able to heal properly. But it's not just about creating new skin cells and blood vessels. The proliferation stage also involves wound contraction. This process helps to decrease the size of the wound, making it easier for the new skin to cover the area. It's like your body is pulling the edges of the wound closer together, making the job of healing that much easier. So, you see, the proliferation stage is all about your body doing what it does best, healing and repairing itself. It's a complex process, but it's also a testament to just how amazing our bodies are. Every time we get a cut or a scrape, our bodies spring into action, working tirelessly to heal the wound. It's important to remember, though, that everyone's body heals at its own pace. Factors such as age, overall health, and the severity of the wound can all affect how quickly your body moves through the proliferation stage. But rest assured, your body is always doing its best to get you back to full health. So, when you see new skin forming over a wound, that's the proliferation stage in action. It's a sign that your body is well on its way to recovery. Now, your wound appears healed from the outside, but the process isn't over just yet. This is where we dive into the final stage of wound healing, maturation. Unlike the previous stages, which are relatively rapid, the maturation stage can take its sweet time. In fact, it could take months or even up to a year or two to fully complete. So, what's happening during this stage? Well, let's think of it as a construction site. The inflammation and proliferation stages have set up the framework, and now it's time for the finishing touches. The body is essentially remodeling the wound to make it stronger and more resilient. The key player in this stage is a protein called collagen. During the proliferation stage, collagen was rapidly produced to fill in the wound, forming a sort of scaffolding. However, this initial collagen is relatively weak and disorganized. It's a bit like hastily throwing up a tent to shelter from a storm. It does the job, but it's not exactly the sturdiest of structures. In the maturation stage, the body starts to replace this initial weaker collagen with a stronger, more organized version. This is achieved through a process called collagen remodeling. The cells responsible for this are known as fibroblasts, the diligent little builders of your body. They break down the weaker collagen and replace it with stronger fibers. This new collagen has a different structure, more like a tightly woven fabric than a loose net. This makes the healed tissue stronger and more similar to the original undamaged tissue. It's worth noting, however, that the strength of the healed tissue will only reach about 80% of the original tissue's strength. All this time, the wound is becoming less and less visible. But remember, just because you can't see it, doesn't mean it's not there. The maturation stage is a silent but crucial part of wound healing. It's the unseen work that ensures your wound doesn't just heal, but heals well. So, even after the wound seems healed, your body is still hard at work. It's a testament to the incredible, intricate work that goes on beneath our skin, a process that we often take for granted. We've journeyed through the fascinating process of wound healing, but what does this mean for wound care? We started our exploration by debunking some common misconceptions about wound care. We learned that it's not always best to let wounds air out and dry. In fact, maintaining a moist environment can often promote faster healing and reduce the risk of scarring. We also discovered that not all wounds need antibiotics, and their indiscriminate use can lead to antibiotic resistance. From there, we delved into the dynamic, intricate process of wound healing, which unfolds in 3 distinct yet overlapping stages. The first stage, inflammation, plays a crucial role in preventing infection and preparing the wound for healing. It's characterized by redness, heat, swelling, pain, and loss of function. But these are not signs of a problem. Instead, they signal the body's proactive response to injury. Next, we witness the proliferation stage, where the body rebuilds damaged structures and reinforces the wound with a new network of cells and blood vessels. It's during this phase that a wound may look worse before it gets better. But remember, this is a normal part of the healing journey. Finally, we entered the maturation stage, the longest phase of wound healing, where the body fine-tunes the repair work and strengthens the new tissue. This stage can last anywhere from several weeks to a couple of years, depending on the severity of the wound. Throughout this process, it's essential to keep wounds clean to minimize the risk of infection. But remember, cleaning too aggressively can damage new tissue and delay healing. And while it's important to seek medical attention for serious wounds, understanding these stages helps us appreciate the body's remarkable ability to heal itself. With this knowledge, you're better equipped to handle wounds and understand the process your body undergoes to heal itself.